So welcome to today's didactic. We're going to kind of pick up where we left off last month when we were talking about um, making neurodivergent friends. And a large part of that was wrestling with what it means to unmask in friendships. And so we're going to continue that conversation talking about unmasking as neurodivergent professionals. Um, can we actually do that? What does that even mean? Is that even a good idea? And I think answers to those questions are very personal and complicated. So a little bit about me. I'm eligible. I have a master's in counseling psych. I'm a licensed counselor in Washington. My pronouns are she, they. Um, I'm white. I'm able-bodied and straight size. Um, I'm still in the process of unpacking what it means to be in my body and the systems that we live in. And I'm not sure if straight size is the best language for me to describe that, but what I'm trying to describe is that wherever I go, there's clothing that fits me. I never have to worry about chairs or spaces when I go to offices or people's houses, they fit. Um, and that's not the experience that everyone has. So if you have feedback about other language for that, I would love feedback. I'm neurodivergent, but I didn't learn that about myself until adulthood. So pretty far into the unpacking process with that, but still unpacking. And the more I unpack, the more I am just amazed that I didn't get identified earlier. I'm queer and non-binary. I'm often perceived as a straight woman. So with that comes some privilege and some safety, but also a lot of erasure and a lot of feeling lonely and unseen in spaces. I am Southern. I grew up in various places in the Deep South, but the majority of my growing up was in rural Mississippi. I have a history of housing and food insecurity. Now I'm lower middle class. I left the high control religion of my family of origin and all of what that involves. Um, like I said, I have a master's in counseling psych. I'm a parent of biracial Black children, and my home is multilingual and multi-faith, including Islam, Christianity, Indigenous, earth-based, and agnostic. And those last two parts, I don't want to conflate those with my identity because those are about my relationships, but I did want to share them because living in those relationships does have a huge impact on how I process my identity and process the systems that we work in. And when I was making this slide, I have a um, self-made headshot that I took, I think, like 4 years ago and felt very uncomfortable making, trying to figure out how to look professional. Um, and as I was processing this topic and what professionalism means, what unmasking means, I realized I want to get a new headshot, but I don't have that yet. And so I was flipping through pictures where I felt unmasked. And even though this one's blurry and not professional, this was a picture where I felt so happy and unmasked and truly myself. And I was with people that I love very much in my home. And so, yeah, there's a picture of me unmasked. Okay, so why would I share personal parts about my identities, especially my invisible identities, instead of a blurb more about my professional identity? Um, this feels really important to me because I don't think that we can unmask well without wrestling with our own intersections of identity and how those parts of our identity function in the systems that we live in. And so I think it's really important for me to practice that vulnerability, and it's important for us to practice wrestling with that together in community. It actually makes me incredibly uncomfortable. I would be much more comfortable just sharing a little blurb that did not feel so vulnerable or personal. Um, when we show up in our professional roles, we're still showing up with our visible, less visible, and invisible identities. And so I really want us today to think about what is the function of how we package all of that into our professional presentation. And I really want us to consider what it is that we've expected our professional role should be, and who that's serving, and what might be a different way of imagining what our professional roles could be. And we'll talk more about that. We can't untangle our experiences with masking without nurturing an understanding of how our different parts of identities move through the systems in place. We all have areas to examine where we may be drawn to putting energy towards parts that are accepted and praised in our systems rather than putting energy towards community and dismantling the systems. And we all have areas to examine where we have internalized negative beliefs about parts of ourselves that are not valued or even scapegoated in our systems. And I really think to unmask well in community, we have to wrestle with where different parts of our identity fall in these systems. And all of our experiences are going to be a little bit different with what parts of our identity do we feel ashamed of versus what parts of our identity do we use to try to get external validation or acceptance or safety. So what is unmasking? We use this term a lot, and it might be helpful just to pause and reflect on what unmasking means more specifically to us. So at this part, I invite you to drop your thoughts into the chat, or you can unmute and chime in with your thoughts popcorn style. I know that can be hard for a lot of us, so I just want to set the frame saying that in our space, you don't have to worry about chiming in the right way, quote unquote. We're really glad to be here with you and all the ways that you show up. It's okay to accidentally interrupt, to struggle to find words to express your thoughts, or share a thought that isn't fully processed and get feedback with a different perspective. So that being said, I would love to hear, how do you think of unmasking?
Hi, I'm Tanya. I also have neurodiverse diagnosis myself, and I'm really it's masking is very hard for me. I don't do it well at all, which is difficult because people really do sometimes find that my ADHD, over talking in a huge way and sometimes oversharing in a huge way, um, are um, problematic, especially for groups that don't understand that. Um, and so I it's extremely hard for me to mask. It's very uncomfortable. And so I have made it a point to try and find people that I can be real with because it's so difficult for me to hold things in tightly as a person with ADHD.
Mhm. I feel you on that one.
We had some feedback in the chat too about unmasking, meaning allowing your natural impulses, embracing being silly because a mask feels like you're making yourself be serious, swearing and talking quickly, showing up as your full self with big emotions and high energy, flights of ideas. Oh my gosh, there's lots of things coming in the chat now. Someone says that masking is like editing themselves in real time to try to relate to others. Steph said talking about rocks and birds. Okay, they're pouring in too quickly for me to keep up, so I'm gonna mute and read them if anyone wants to chime in verbally.
Yay, I love participation. Thank you, everybody. All right. Well, we will keep talking about this. And I really appreciate what you chimed in and said, Tanya, too, about noticing how your body responds when you mask a lot versus when you're with people where you can unmask. And we're going to talk more about that in the professional space. All right. So to understand masking and unmasking in our world, I really think we have to understand white supremacy culture. And for those of you who haven't read about white supremacy culture, I really like this poster that the artist Melanie Walby made about the tenets of white supremacy culture. It's a little bit hard to see here, but the tenets are either or thinking, um, the written word above everything, objectivity, individualism, quantity over quality, power hoarding, fear of open conflict, progress is bigger and better, paternalism, defensiveness, sense of urgency, one right way, right to comfort, and I'm struggling to read that last one, and I can't remember what it is. I can't read that. Oh, perfectionism. That's such an important one with our conversation. And when we're thinking about these, they are less of cognitive beliefs that people hold. And this is more the undercurrent of our culture. And it sits in our nervous system. So these beliefs are things that we feel in our spaces as expectations and things that we're supposed to do and not do. And depending on the intersections of our identity, we all have different ways that we try to mask to fit in with these tenets of white supremacy culture. Let's see. So I'll read the slides for accessibility. So we cannot understand why we create the mask we create without understanding white supremacy culture. White supremacy culture informs how we are taught to perform professionalism. And it teaches us what parts of us are of value and what parts are shameful and should be masked. And it informs how we are expected to interact with one another or not. All right, so just keep these in mind as we talk more about masking and professionalism. Just notice where some of these tenets might pop up. All right, so self-disclosure is something that comes up a lot when we talk about unmasking in professional spaces. And I want to talk about self-disclosure versus setting the frame. And so in clinical spaces, setting the frame is when we talk about how the therapist sets up the therapeutic space to create a space to connect and process therapeutically. So self-disclosure of our invisible identities explicitly or implicitly is discouraged in most of our clinical and professional trainings. We are taught that we are not supposed to bring our stuff into the space. We are holding space for the clients or the people that we're sitting with professionally and whatever our capacity is. And we are not supposed to bring our own personal things into the room, but our identities are with us, whether we speak them or not. And the more we can have awareness of that, the better. And I would argue that while it is within our therapeutic role to follow the lead of our client and be mindful of what we're bringing into the dyad and for what purpose we're bringing things into the dyad, we are still responsible for setting the frame. And I would argue that self-disclosure of our invisible identities is part of setting a neurodivergent affirming frame. And practicing unmasking in a professional setting, oh, that's what I just said, is part of setting a particular therapeutic frame. And I'll just pause here and see if anyone has questions or reflections that they want to share before we move on to the next part. Okay.
I like, think this is a really big part of my therapy.
Mm,
Um, being, especially because I really try to work with neurodiverse clients, and I feel like it, especially with ADHD, it makes it a lot easier to understand what they're saying. I think they feel a lot more accepted and heard,
mm,
when they don't have to try and edit their voice so much. Um, and I'm pretty sure that most of them identify pretty quickly. I'm also with them, so
mm-hmm.
I don't think it's I don't think it's something I can really hide that well at all during sessions. So
Mm-hmm. I've been thinking about that a lot since our discussion with Marie last month. Um, for those of you that were there, Marie was talking about in making neurodivergent affirming friendships, um, that it's important to unmask so that we can find our people. But when we've been taught to mask, um, it's really, really lonely because neurotypical people experience us kind of like uncanny valley. So even though we're performing the neurotypical behaviors, it feels off. And then unmasked neurodivergent people experience us as inauthentic and hard to connect with. And so it ends up being really lonely and we can't find our people. And I've been thinking about that a lot as a neurodivergent therapist. Um, and what it means to unmask and not be the right therapist for everyone. But that also means that it's easier to find the people that we do need to be working with, or that are a good fit for us.
Yeah, I would love to share if that's okay.
Oh, yes, please.
I have so many thoughts on this. I think in the last year I've been doing this more,
Mhm.
disclosing my invisible chronic illness and all the many chronic illnesses that our neurodivergent clients have as well. Um, and like naming with a new client those illnesses and how they might impact our work together. I have a lot of GI issues. I think
Mm.
just naming it up front has been really helpful for clients to feel the like permission for them to immediately change gears if their body's telling them something. Um, and I also will say, like, you'll notice in our sessions, I will not be performing attention for you. I will be looking other places. I will be staring at the wall. And I also don't need you to perform that you're giving me attention. And some of them have never even thought about that, how like they're not naturally actually going to actively listen if they're performing eye contact for me. Um,
Yeah.
and yeah, I think there's so much to say with this about like what the lies of white supremacy and professionalism and all the things it makes me believe I'm not supposed to bring to the space that make it the perfect fit for neurodivergent clients if we bring those things.
Mm.
So yeah, I'm so excited to hear what else you say.
Yes. Oh my gosh. Yes. Thank you for sharing that. Um, yeah, I really appreciate that. I've been slowly unmasking with clients over the past few years. And it's really scary to unmask, especially with people um, who are very masked, for me personally, who are very masked themselves or communicate that they hold very high value on somebody being articulate. So for me, part of how my neurodivergent shows up is my words are very, they fluctuate. So some days I wake up and for whatever reason, words are available to me and my brain thoughts come out in words. And some days I wake up and they just don't. um, and I used to feel really, really anxious with clients who I knew valued intellectualism and academia and people being very smart and articulate. And I would try to perform to that. And it's so much better for me to just be honest about my brain and how I'm showing up. And it's led to really helpful conversations versus being performative, of what I thought professionalism should be. Okay. So relationship to rules. I think a lot of us are vulnerable to trying to find a new set of rules when we're becoming clinicians. So a lot of us neurodivergent providers and professionals have um, really painful and vulnerable histories of being shamed and thinking that we were engaging with people and then finding out that they didn't like how we were showing up or that they think we did it wrong. And so a lot of us learn to cope by trying to learn all the rules and make sure that we are following the rules of spaces so that we don't get shamed and excluded. So when we move into professional spaces, I think many of us still really fear doing things the wrong way, or we struggle with imposter syndrome, like we're hiding some kind of secret. And so we compensate by trying to learn our new professional rules um, about how to practice clinically. But I think we really need to look at our systems and consider who do the rules of conventional professionalism serve? Who do they exclude? Um, when we are putting on our role of being a professional, what is the purpose? What are we trying to achieve with that? Are we hiding our parts? Or are we facilitating a space where people can come and unmask um, and look at the parts of themselves that they've been afraid to look at? We all need community to practice questioning these rules and imagining new ways of being in professional spaces. So I look forward to this time every month so much. I'm so glad that we have this community to have these conversations. But the answer is not as simple as we need new rules. It's not as simple as there's another way to put on your professional identity or like one right way. The risk of unmasking are different for each of us depending on the intersections of our identities, our circumstances. Um, and the answer is not just, well, every neurodivergent person should live authentically and unmask. It's so much more complicated than that. Masking is a necessary survival skill for many neurodivergent people in many spaces. And it's especially important for Black men. It can be very unsafe for Black men to unmask in a lot of environments. And so unmasking cannot be done as an individualistic pursuit. It's something that we have to pursue as community. And I just want us to have more conversation and curiosity around how do we do this well? How do we practice this well when unmasking needs of individuals in our community are different? If anyone has thoughts or conversation around that, I would love input.
And something that I was thinking about mentioning earlier, but feels relevant here is it's amazing how much you can convey without always having to say too much, right? And so like a lot of times if you can identify what is the thing that I'm going to do that my clients need to know about, for example, if I just say, I have like a whole spiel on how I work that I share with clients, and I could share all of those things in that spiel without ever directly naming these are because of my ADHD. And I try to talk about that a lot with folks and both clients and other clinicians that I support. That like there's a lot of ways that you can ask for what you need or share what you need or how things will present or how you work with others. And if you're able to just do that in a direct, confident kind of way, people actually tend to just accept it, right? If you're just like, oh, I need to look around while I talk, and then that's it, and you just say that, people don't tend to question you a ton. Or if you say, I need to take some notes so that I don't, forget what you're sharing with me. So if you notice me looking at this screen, that's what's happening. Like that's one of those things that I share. Again, I don't have to even directly say, I have ADHD and poor working memory, and so I need to take these notes so I don't forget everything about you. I don't have to say it in that way. And I can still, so I think that's something that can be helpful for folks who maybe don't feel safe fully unmasking, is to think about, are there ways that you can still share whatever the need is or share whatever you need your client to know about how that impacts your interactions. And you don't have to share the background reason, but if you do that in kind of an assertive, confident way, it's generally pretty well accepted for the most part. And again, it's also modeling for clients, even if they're not in a place that they can do that themselves. It helps them with that. And so I think that's something for those folks who are uncertain about masking or directly naming their neurodivergence or other kinds of things, that you can think around pieces of that, of how you can make that work for you.
I really like that with the modeling piece. It helps you practice a clinical space that better meets your needs while also inviting that with other people. And that leads really well into the exercise we're about to do. I'm also thinking in therapeutic spaces, just how important it is to model that for our clients, for whom it's not safe to unmask in so many spaces in the world. And the cost of that to people's bodies and to people's nervous systems, and just how important it is that of all places in a therapeutic space, that can be a place to practice unmasking. All right. So we're going to do a little exercise about what is the cost of masking. So you can get into whatever position is comfortable for you. You could have eyes open, closed, soft gaze. You can be up and fidgeting. You could rest your hands on your legs if that feels grounding. And just see if you can bring to mind, and this doesn't have to be visual, this could just be a memory in whatever way you want to remember it, but see if you can bring to mind a time when you felt yourself wearing your mask pretty intensely. And in that memory, try to notice what it was that triggered you to put the mask on. Notice who the people were that you were masking for. What was it that they were putting out into the room, into the situation? What were the parts of yourself that you were needing to hide for safety, or parts of yourself that you were ashamed of? And as you remember this memory of wearing your mask so intensely, notice how your body feels. Notice where your energy levels are. Notice your motivation. And if anyone would like to share about this before we move on to the next part, feel free to pop into the chat or unmute yourself and share what you noticed. Zach, I think you're talking, but I can't hear you. Still not working. Oh, tech issues. Okay. Would you like us to move on to the next reflection, or is it tech issues that'll be fixed pretty shortly? Okay, well, please pop back on when they're fixed so that we can hear your thoughts. Okay, thanks. Okay, takes time. Gotcha, Zach. Okay, so for the next part, You can get back into whatever position feels comfortable for you. You can move, you can fidget, you can sit with some pressure on your legs, whatever feels best. And think of a time where you felt very authentically you, very unmasked, very free, where you were not censoring yourself. And think about what it was in that situation that felt like it invited that. Think about the people who were present. What was it about them that felt safe to you? Notice what you feel in your body as you remember this experience of being unmasked. Notice your energy. Notice how your brain is working. Notice your motivation. And if anyone wants to share a reflection from that, they can. And the reason why I wanted to, oh, somebody said, I just teared up at different moments, at different times between those two moments. Yeah. Yeah. I think, so many of us have masked so much and it feels so normal for us. We are not aware of the cost um, that masking actually has and how much of our energy it actually takes up. And I do think that's really important to pause and notice. And part of why I wanted to do this reflection is I think so often when we are moving into professional spaces and feeling all of the unspoken expectations of what it means to be a good professional, um, we come up with our professional mask and we put it on. But when we're thinking about creating a frame and using self-disclosure implicitly or explicitly to create a neurodivergent affirming space, I think it's helpful to think about the people we've been around and the spaces we've been in where we felt free to unmask and what that felt like in our body and what were the cues that we picked up on, letting us know that it was okay to do that. And I think a lot of times it's because we are around other people who have done the work to unmask. And just being around people who've done the work to unmask provides so much invitation. And so I just wanted to do that exercise to challenge us to bring more of that to our sessions. Okay, Zach, is your tech working?
Is it working? Yes, it seems
Yes,
to be.
yes,
Great.
yes.
Okay. Awesome. Sorry about that. So I guess answering like the previous question for me, whenever I notice myself like masking professionally, it tends to be during times, in meetings with like neurotypical, or like non-autistic practitioners who have a very like medicalized point of view about like what success means for our folks, and who, get like emotionally reactive, during like times where like autistic people are, advocating for silly things like using identity first language or, including autistic people in, places, settings, or matters that have a direct impact on our lives. So, I noticed then I have to spend so much more energy just like walking the tightrope, trying not to like isolate or like ostracize them since they often have a lot of, power in these matters. So, that's when I find myself doing it most often. And then the cost is just like, the cognitive fatigue and exhaustion that sets in, and the fact that I'm probably spending 3 times as much energy as I would, doing it my non-masked way. So yeah, it's
Yeah,
exhausting.
yeah. Thank you for sharing that experience, Zach. I think that's a really helpful example too of noticing how the intersections of our identities and the systems in place interplay with how we mask and when we mask, when it's needed.
Hi, I'm Taylor, he, him pronouns. There's kind of an interesting conversation happening here in the chat that is making me realize that there's a really big difference between the intention to unmask and the ability to. And for various reasons, whether it's social anxiety, inhibition, nervous system dysregulation, and I think it's really important to name that and also to think really strategically about that and also to kind of approach that with radical acceptance.
Mm,
It's not sufficient to decide that you're ready to unmask. It really is something that requires enough experienced safety in that setting and enough capacity to modulate the way that you present in a certain space.
absolutely. Thank you for bringing my attention to the conversation in the chat. I'm having a hard time reading all of it right now. But this is so thoughtful and helpful with people talking about their experiences with their nervous system in different spaces. And I think it's really important for us to have these conversations more as community. We really cannot do this on an individual basis. We have to navigate this together. And it's not as simple as, like you said, it can't just be, I've decided to unmask, so I should unmask, or all neurodivergent people should unmask, because there's so many situations depending on the intersections of our identity, and the systems that we're in where it's not safe. Something that I think about a lot too is, I'm struggling to multitask here right now. I can't wait to read all the chat more closely. This looks really rich. But something that I think about a lot is the difference in needing to put my mask on because I know strategically that's needed in a certain space, or a certain space isn't safe for me to unmask. And while that's still exhausting, and I need to recover from that, that feels very different to me from when I have masked because I'm ashamed of who I am and I feel like I need to hide a secret about myself. Somebody said, I think about masking from a place of advocacy as putting on my cape, not masking. Yeah. So kind of putting on a role. Yeah.
Yeah, there's some talk in the chat too about having to work in like different departments and areas and how jarring it feels to go back and forth between those two environments. There's a lot of really good reflections about who people find that they can unmask with. Bobby Joe is saying that a lot of time other ADHDers are the ones that come to mind. And I also personally really agree with that. Um, and then, yeah, some people are throwing it back to the tenets of white supremacy and how professionalism and masking professionally relates to feeling like you might be perceived as incompetent in your work if you don't present in a white supremacist version of professional.
Mm-hmm. Mm-hmm. Yeah. That's such a helpful reflection. And then reflecting on our own identities, and depending on our identities and our intersections, who can challenge that idea of professionalism in what spaces, in what way. It's going to be different for different people.
And then another comment just came in that I think is really cool, and it is talking about learning to mask at a really young age, kind of as a survival strategy, and having parents who highly mask.
Mhm.
and how that can just be tied to attachment and like abandonment and core wounds, and how that can complicate unmasking.
Mhm. Oh, absolutely. Yeah.
I
Can I
also was,
share? Sorry.
go ahead.
I was just gonna say how much I relate to the comment about not about working with parents versus clients, and that feeling of that high masking with parents and how it doesn't feel quite as natural as working with our autistic folks or ADHDers for some reason.
Mhm. Mhm. Well, and something that I've been thinking about a lot um, with unmasking in community, and I would just love more thoughts around this, is we need more neurodivergent providers in schools and in medical spaces and in agency spaces. It is so needed. And the cost to neurodivergent people being in those spaces and being unable to unmask for so much of their work week um, is huge. It's not sustainable. And I realize, in working at Holistic, I get to be unmasked and authentic all the time, like in my workspace and in my personal space. And that is not what it feels like to work in bigger institutions. And so I just wonder, how as community do we provide more support for our neurodivergent community who are in those spaces?
Yeah, I think that that is very, very true and very hard. And I think that is why I don't work in institutions. I have my own private practice because like I said, I don't know if I can mask. It is exhausting. I don't even know. Um, it has never been something that has worked for me. It feels horrible, and I tend to just try and stay really far away from places that are extremely uncomfortable. One of those being institutions, because of the way working for institutions and groups, the judgment I feel and just the separation pushed away from other groups is kind of breaks my heart a little bit. And so that's too much for me to take. Um, and so I also have started my own local meetup group because of that, because I want to be around people that are like me, and not just in the neurodivergent field, but also in the queer community. And I am not good about not being myself at all. It's horribly hard. And so these are people that um, I think it just makes a difference of me running it where it's my way. So I let everybody in who has neurodivergent. I let everybody in who has disabilities. And I want everybody to just feel as open and free to be themselves as possible because I cannot not do it, And I do not, I think that's great that they have that at Holistic in Seattle. It's too far for me to travel to, and I do not want to work in an office space yet with COVID, but I think that is a wonderful space that is open for people. Um, and I don't know. I had envisioned dreams of one day like actually having another space up here that would be more queer affirming and neurodivergent affirming for therapists um, and clients, but I'm not nearly there yet. So, but I think it's really great that you feel comfortable at Holistic.
I'm not getting to thoroughly read all of the chat because I'm struggling with multitasking, but there's some really helpful feedback in there, comments in there about people noticing differences in their nervous systems when they're sitting with clients who have internalized ableism. I feel that with clients or other people. I can feel it in my body and feel myself pulling towards performing. It's really hard to unmask. Jess, yes.
Yeah, I'm sitting thinking about something. Is it Margaret or Margot?
Margot.
Margot, thanks. What Margot said and what you said, Ellie, about parents and children and institutions. And as a neurodivergent practitioner and parent to neurodivergent kids, where I was raised to be highly masking, and I'm attempting to raise my children without that pressure, like finding the strategies of like how to communicate with their school administrators and the paraprofessionals and all of the professionals that they work with, and trying to like struggle with my own masking, unmasking, and how it's being mirrored in my children is like such a challenge.
Mm-hmm. I feel that experience of unlearning while we learn together with our kids. And so often I feel that with clients as well, that we're learning this simultaneously.
There's also Steph was talking about in the chat, throwing it to the working in institutions again, and how it tends to drive out neurodivergent people, which then just compounds the problem of isolation. And when they were in the field, just feeling like such a failure because it's not a place where you're even set up where you can be successful. You know, if you're working in a place where even the lighting and the noise is distracting and activates your nervous system, how are you gonna focus on your job?
Mm-hmm. So in the next part of our conversation, I wanted us to think about what we're often taught clinically versus imagining a new way, and hoping that we can continue to imagine new ways together as community. These were some ideas that the holistic staff came up with, how we've been trained for best practices, which prioritize neurotypical standards, and I would say also prioritize white supremacy culture standards. So things that we've been taught around the therapeutic environment, being sterile, that we're not supposed to accept or display client gifts or their art, that there's not training or discussion in most of our programs about creating accommodating, sensory-friendly spaces for ourselves or the client. And people can chime in at any point as we're going through these with things that they've been taught in their programs. I would really love to hear things that you were taught were best practice. With the therapeutic relationship, we've been taught that there is certain protocol for building rapport with clients, which includes limited self-disclosure. We don't share about our invisible identities. Boundaries have to look a certain way. Connection has to look a certain way. And I think this is an area where we can get into that uncanny valley feeling of a professional mask, where we are trying so hard to follow the protocol for how to have a therapeutic relationship versus just being our quirky, weird professional selves. And as I said that, I know quirky can be a triggering term for many neurodivergent people. So I'm going to be more careful with that one. All right, and we're taught about emotional neutrality with an emphasis on remaining emotionally neutral in session. We are discouraged to express our emotion in front of clients, which I feel like is very off-putting for many neurodivergent clients when they're not getting feedback and having a hard time connecting, noticing our mask and noticing that there's an incongruence in the emotional content of what's happening versus what's being expressed. With what we're taught in school, we have a very limited exposure to different therapeutic styles. We are often guided towards evidence-based practice, which typically have been researched on their efficacy for neurotypical people. And we're not taught about other ways of connecting, other modalities that might be effective for different populations. And then we're taught things about workplace and organizational culture, with emphasis on what workplace boundaries look like, what connecting with our peers and community looks like. And there is in many institutions, there is very little validation or support for moral injury or burnout. And I think this goes back to what Steph was saying earlier, about how neurodivergent people are pushed out of these spaces with a lack of accommodation or lack of understanding. Do people have other ideas popping into their head about things that you were trained to do in your professional trainings or your programs?
I have two thoughts that are coming up. One is that kind of back to that emotional neutrality, that, if a client wants to end services with us or something, that we're not supposed to have any emotions about that. Right. So like somehow we're supposed to build this therapeutic relationship, but then we're not supposed to care at all when that relationship abruptly ends. Right. And that, I think, some of that RSD stuff that I know I've struggled with, and like there's the two sides of it of, professionally and with my client, yes, I'm not going to put on to them, any particular thing, but even when trying to seek support in consultation types of spaces or that kind of thing, it's the client's choice. But yeah, I get it's the client's choice, but I'm allowed to feel sad that they're making a choice and I don't get to work with them anymore. Right. Like, and so it feels like in some spaces it's been taught that, everything should be neutral, which again, to me is just an oxymoron of, you want me to build a healthy relationship, but then I'm supposed to have zero emotions when the relationship is just suddenly removed. Make that make sense. And then the other example, something that I've noticed about myself a little bit and been reflecting on lately is, I was really taught like you never give a client like direct advice, right? And I think like I took that like really far, where sometimes I won't ever even give a client like, an opinion on a situation, and I still am very leery to do that. But I think particularly with some of my neurodivergent clients, that like there's sometimes where, they are just so stuck in whatever, is happening for their anxiety or things like that, when objectively there's a pretty clear answer to somebody who's not in that space, right? And they really just need somebody to give them permission or to tell them something. And in some ways, not me holding back this response that would just help them move on, but I felt like, well, I'm not allowed to share any thoughts or opinions. And again, there's lots of ways we can use our language, and I'm not suggesting by any means that we start telling clients what to do, but even just like having so much rigidity around that, I think parts of me were so scared to even give them any sense of direction, and again, these aren't even big life choices. Sometimes it's just like they're trying to decide between these two choices, both of which are good. And they're in loops of if this then this, and if this then this, and a decision needs to be made. And to me, sometimes there is a clear better choice, but and there's ways to even ask that, but I've noticed parts of me feel resistant to even saying anything, when again, I think with really good discretion, there are times and places where some direct support might be useful to folks.
Mm-hmm.
I think also that whole idea of the psychodynamic therapist that can just remain perfectly still and just be a reflection and not have any kind of emotional or any kind of visible response, you know, it totally goes against that whole neurodiverse affirming thing of like using your fidget toys and being wiggly and you know, I notice too, sometimes clients shut down when you come at them with that approach, our client population. And there's this, because it kind of triggers that that masking, like that you're talking at them and, you know, they shut down. Whereas sometimes when I present it like, hey, there's some people that have this issue and kind of, you know, what do you think about that? It kind of takes away some of that feeling of talking at them, or and it kind of helps them backdoor and incorporate that solution, because I think it's probably the experience that a lot of neurodiverse people of being in trouble all the time. So if you're talking to me about something, I must be in trouble.
Mm-hmm.
So I feel like that makes it a little bit more like, hey, there's this problem. What do you think? And it's a little bit more collaborative.
There's some interesting comments coming through in the chat too. Gabriella is saying that they were taught, not explicitly, to be condescending with clients. Like the words they were told are that the clients are the experts about themselves, but in practice it was condescending. And when a client made the incorrect choice, there was like some detachment. Gabriella is like saying they don't exactly know how to explain this. So maybe if someone has, someone knows the feeling, they can chime in. And then Kaylee, not sure how to pronounce your name, brought up the topic of dual relationships and how, you know, we need neurodiversity affirming spaces, but they might be the places where we also refer clients to. And then how the whole dual relationship like is to protect clients, but also is rooted in white supremacy culture.
Ooh, yes. Okay, so that idea about dual relationships and white supremacy culture, I'm so curious about unpacking that one more. I did brain spotting a couple years ago with two teachers that were really helpful. And I've learned since that the way different people teach brain spotting is everybody brings their own style. So not everybody that I know who's taken brain spotting trainings has gotten what I got from these teachers, but one of them talked over and over and over about ethics and who do the ethics serve, and just really challenging us to think about in what way our ethics that we've been taught in school might actually support white supremacy culture and support people in power, versus supporting people who are oppressed. And so not at all advocating that we be unthoughtful in our ethics, or how we're engaging with clients, but actually to be more thoughtful and to question the rules that we've been taught and to imagine different ways of doing things, including with dual relationships.
This is going back to what somebody was saying about the giving advice versus being condescending. I had an experience recently with a client where I was asking questions of them to try and understand, like, what exactly is happening with you in this experience? What is important to you about it? Why, how is it affecting you? And I realized that my questions were coming across as like, have you figured this thing out yet? Like, there is a way that you should be responding to this. Have you figured it out? So I stopped myself and was like, I just want you to know, like, I'm asking these questions because I'm genuinely curious and want an answer, not because I'm trying to lead you down this path of, I know something and I'm trying to get you to discover it. but
Mhm.
because like I actually need the information in these questions that I'm asking. And that helped them open up and answer my questions better. But then I realized maybe like 15 minutes later in the session, I started to do the thing that I just said I wasn't doing, of being like, I think I know what you should be doing. Let me try and get you to say it. And so then I stopped myself again and was like, so actually, I found myself doing this. So would you like to hear what I think about this situation? And then they said yes. And so then we had, I think, a much more direct conversation in both ways, both of me getting more information from them when I needed to, and also talking much more directly about, I think that there is action you should be taking. Let me share that, instead of being condescending about it.
Mm. Hmm. I really appreciate your vulnerability in that story, of showing up with what was happening presently in the relationship and then being able to work with that. Mm. So we are going to go ahead and end the video, and then we can move into consult and further discussion. I really appreciate everyone being so participatory today and being present. I hope that this is a conversation that is a community here and then in our other community spaces, both in our careers and in our personal spaces, that we can continue to unpack and really question how we're showing up, how our body feels in the different spaces that we're showing up. What is the purpose of how we're showing up professionally? What is the purpose of our different mask or roles that we might put on? And how do we imagine something that feels better for us, for our clients, for our community? So thank you. I'm very grateful to this community.